Gather around the TV, ladies, because on this morning's Ask It Early, our own Dr. Jennifer Ashton is here to answer your questions about the controversial new mammogram guidelines that she herself has been asked about repeatedly by her patients. Good morning,
That's
Doctor.
right, Maggie. Good morning, you guys.
And of course, we have a ton of questions from viewers as well, so let's get right to them. We have Angela Walker standing by in Atlanta. She's under 40, and she has a question for you. Go ahead, Angela. Good morning.
Good morning. As a 34-year-old woman who recently had a breast cancer scare, I wanted to know what your thoughts were as a physician about these mammograms being eliminated for women before they're actually into their 40s.
It's such an important question because we know that breast cancer increases as women age, but there are some breast cancers that are detected on things like ultrasound/mammogram in younger women. And of course, those are the women with the young children. It has an impact for every woman, but especially when you're talking about a younger woman. And those are the women that in my practice, I'm finding the most fearful, the most anxious about these new recommendations. So usually what we tell young women from 40 on is we had said every year. And I, in my practice, Angela, am continuing to recommend that. When you talk about under the age of 40, if you have other risk factors, it's really kind of uncharted territory, so we really do individualize it in younger women.
Before we go on, why don't you just go over the new guidelines in a nutshell so people know what we're talking about?
So we used to start recommending mammograms at age 40 and then every year.
For all women or just women with a cancer risk?
For an average risk woman, so we're not talking about a high-risk woman here.
Okay.
The new guidelines suggest that maybe we shouldn't start doing that in their 40s and that women should start routine mammogram screening at the age of 50, and instead of doing it every year, do it every 2 years and then stop mammogram screening at age 74.
Let's bring in Virginia from Nyack, New York, and our thanks to Angela. She wrote us an email, Jen, and she wants to know, she says that her mother is a breast cancer survivor and her dad's sister died from breast cancer. Her doctor insists that she have a mammogram every year and even wants her 20-year-old daughter to have one for a baseline. Virginia wants to know how she can remain proactive to keep the disease from striking them.
So a couple of things in that question, Maggie. First of all, when you talk about a high-risk woman now, which is someone with at least one first-degree relative, so a mother, a brother, a sister, or a daughter with the history of breast cancer, or someone who has a genetic mutation, the BRCA mutation, they are in a different group and it's much more individualized.
So they're basically exempt from this?
They really are.
Right,
they really are. These new recommendations
do not
apply to them.
Right. Take yourself out of this group.
That's right. Now, what's also kind of uncharted territory, though, is when you are at high risk, we really don't have sweeping recommendations about when to start screening younger women. So 20 there's no data to support that at all. Usually we say about 10 years before the age that your relative was diagnosed. So if you have a relative diagnosed at 45, we usually say get your first mammogram at 35. The exciting things hopefully in the future will be there will be better testing methods, better screening methods to identify those at high risk, and we don't have those yet.
There was also a question about the value of self-exams.
That's right.
What's your take on that?
And the task force actually said they advise against it, Russ, because they have found to be very inaccurate and generate a lot of anxiety. And again, the unnecessary biopsies and invasive procedures. What I tell my patients, and I start this with my teenage patients, is you should know what your breasts feel like. It's part of your body.
Of course.
And if you're concerned about something, you bring it to your doctor's attention.
Very surprising that they would go there. Yeah.
Who are the people on this task force making these decisions about women's breast
Well,
health?
that's really important to look at, Maggie, and a lot of my patients are asking me the same thing. Who is this task force? Let me tell you who it's not. It does not include a radiologist. It does not include a medical oncologist or surgical oncologist. It is made up of government-appointed but non-federal employees, doctors, PhDs, public health experts who analyze computer-driven data, but there are a lot of limitations to the way, and they admit them readily in their guidelines. There are limitations. They didn't take into account racial differences, and we know that
Which is hugely significant.
and breast cancer can be much more aggressive and detected later in African American women. That didn't enter into their picture at all. So there are limitations, and they themselves really point these out too.
All right, we want to go outside. On the plaza is Linda, and when we were out there, she said that she had a question that she would like to ask Dr. Ashton. So please go ahead.
Hi. Dr. Ashton, my question is, the progression of the disease can be so swift. Why on earth would they change the recommendation to have the mammogram every 2 years instead of yearly as a preventative?
That's another key point, Linda, which is that some studies have shown that the average breast carcinoma takes 3 years to go from a very small size, 1 millimeter, to 1 centimeter, which is the size that we basically think can be palpated or felt by a doctor or a patient. So, but again, when you talk about breast cancer, that's like saying we're going to talk about the weather. There's ductal carcinoma, there's lobular carcinoma. There are so many different types of breast cancer, and some, like Linda asked, are very aggressive and will go from not being detectable on a mammogram 1 year to in the next year showing up, but others are much more slow growing. Again, their study didn't fully account for that.
There are a lot of women who say this was a money decision because eventually insurance companies won't pay for mammograms before 50. So far, they are still paying.
That's right. And they have, Medicare and the insurance companies have said that they don't plan to change their guidelines. But that's what I'm hearing from a lot of my patients. They are concerned that this is financially driven. And at the end of the day, you know, as a doctor, I understand the statistics, but I care for the individual woman. And that is a big problem at this point.
Thank you.
So much more to talk about on this issue because this is all anybody is talking about this week. All right, Dr. Jennifer Ashton, thanks so much.
So if you have any questions about mammograms or other medical issues, we, of course, are going to continue the conversation. Go to our website, earlyshow.cbsnews.com, and ask Dr. Ashton.